Hi everyone, my name is Quealy-Gainer and I'm an organizer with Healthcare Consumers and also the coordinator of the Medicare 100 Plus program. Peggy, please stick around for a little while longer, and Emma, come up and join us. I have the pleasure tonight to present the Harry J. Baker Community Service Award. The Harry J. Baker Award honors community members or organizations whose dedication and work toward improving the lives of people in our community exemplifies community service of the highest level. This year's recipients are Emma Coverdill and Peggy Orr. You already know all about the amazing work of our hotline advocates like Peggy and Amanda, and Emma is another member of our spectacular hotline team. Before I tell you why Emma and Peggy are so deserving of this special recognition for service to our community, let me give you a little background. This year, and in particular the last 6 months, has been an exceptional time with the rollout of the final and most crucial phase of the Affordable Care Act and the opening of the health insurance marketplace last October. When the marketplace opened and clients old and new sought out Champaign County healthcare consumers as the resource for marketplace and Medicaid enrollment assistance, it was all hands on deck for staff and hotline advocates. And wow, did our advocates ever step up when we called on them. On top of all the other hotline services Emma and Peggy provide each week, they also became certified application counselors to help enroll clients in health insurance through the marketplace. Last October, when the marketplace opened, Promise Healthcare and the Francis Nelson Health Center approached healthcare consumers to see how we could partner to get as many of their patients covered as soon as possible. With support from Promise Healthcare and the Carl Foundation, we quickly assembled an all-star team of CCHCC staff and advocates, including Emma and Peggy, to add to the existing outreach and enrollment staff at Francis Nelson. As a federally qualified health center, Francis Nelson has a vested interest in making sure that patients are insured, particularly those who are newly eligible for the expanded Medicaid under the Affordable Care Act, because they can receive an enhanced payment for all their Medicaid patients. For years, Francis Nelson has been serving low-income, uninsured patients by providing them with sliding scale discounts on their care. Thanks to the Affordable Care Act and the expansion of Medicaid here in Illinois, and the incredible work of application counselors like Emma and Peggy, the number of uninsured or self-pay patients at Francis Nelson has dropped from 45% last October to just 30% uninsured or with the Medicaid application pending today. Our staff and advocates worked roughly 28 hours each week for 8 weeks from October to December at Francis Nelson doing both marketplace and Medicaid enrollments. Emma and Peggy volunteered a significant amount of their time each week. Emma spent 3 hours every Friday, and Peggy spent 4 hours every Wednesday, plus 4 hours every Thursday from October to December. Keep in mind, this was time spent on top of the regular hotline shifts that they were still doing at our office each week. Now, just so there's no competition here, Emma's time spent at Francis Nelson was just as valuable as Peggy's, because Emma was primarily enrolling Spanish-speaking patients, along with one of our coworkers, Carolina, you met earlier. Until Adani started working with the outreach team at Francis Nelson in February, Emma and Carolina were the only Spanish-speaking application counselors enrolling patients there. I'm sure you can imagine how valuable that service would be to a clinic like Francis Nelson. Emma and Peggy, I hope you know how much your efforts and the sacrifice of your time meant to this community and the patients at Francis Nelson. Thanks to you, hundreds of low-income individuals and families now have access to affordable health care, prescription drugs, mental health services, and so much more. Many of those people struggled for years without insurance and were barred from Medicaid because they didn't meet the criteria of having a disability or having a child under 18. And now they have the peace of mind of knowing that their care at Francis Nelson is covered, as well as anywhere else that they choose to go here. But as I'm sure you both are well aware, our work is not done, and there's still plenty more uninsured people, at Francis Nelson and everywhere in our community who we've not reached yet. So I know both Emma and Peggy will play a big role in that work ahead. So for all of your hard work, your compassion, and your dedicated service to the community, I'm very proud to present Emma Coverdill and Peggy Orr with the Harry J. Baker Community Service Award.